Good morning. My name is Jihea Choi from South Korea. Actually, I'm gonna introduce one of the research. Actually, I'm working at the university and teaching the pediatric nursing. So, like 7 years old, I worked at the United States as the certified pediatric nurse practitioner. While during that period, actually, I worked as like a school screening nurses for scoliosis screening. So when I came back to our country, actually, we didn't have any like a school regulation to check up the scoliosis, but still have a same situation. So I really interested to know how many the adolescents are having the scoliosis, and then what the nurses should have to focus for their quality of life. So I researched the title as health-related quality of life of adolescents with idiopathic scoliosis in Korea. So I'm gonna start. So, as you know, the scoliosis is a complex spine deformity involving three-dimensional deviation of the spinal axis by deformation with thoracic lordosis and lateral curvature and vertebral rotation. And the diagnosis is by exceeding 10 degrees of spinal curvature on an anterior-posterior X-ray imaging. So adolescent idiopathic scoliosis is one of the most common musculoskeletal problems in adolescents, and the prevalence rate of AIS is more than 80% of scoliosis cases. The causes are unknown, and age of onset is 10 years old age to skeletal maturity, and then it predominates in females about 3 to 5 times. The prevalence rate of AIS in Korea, actually, it was like a 0.35% in 1998, but recently it's really rapidly increasing. In 2008, it was 6.17%, but recently, actually, the government is not searching how many percent are of a prevalence rate of the AIS, so I don't have a recent data, but the latest rate, it was a 6.17. But for the United States, they are like an average from 2 to 4%, and then Japan, it's like a 0.87. So I had some question, what are the specific characters of adolescent idiopathic scoliosis prevalence among Korean adolescents? So actually the disease of AIS, they are like a grouping, like mild scoliosis and the moderate and the severe. So mild is for the degrees of the cuff's angle from 10 degrees to 25. And the moderate scoliosis is from 25 to 45 degree, and then severe is of more than 45 degree. So treatment for the mild scoliosis, just observation, taking the x-rays and then just following the patients to the clinic. And for the moderate scoliosis, actually, we are encouraging them to do the exercise and then having a good posture, and then sometime electronic stimulation, and then sometime like let them wear the brace. For severe scoliosis, actually, doctors are recommendation to have an operation. You can see the picture. Around here, actually, this is the braces, and then this is the X-ray after the surgery. So they are inserting the pin and rods to the spine. So how the idiopathic scoliosis affects the adolescents? So I grouped as like a 3 domain, like a physical and psychological and then social. So in physically, limited physical activity because of asymmetry of shoulder height and scapular and flank shape and hip height. And then it affects decrease of body function and musculoskeletal pain. For psychologically, it affects decrease the body image and self-abasement and then depression. And also it affects decrease the quality of life of the adolescents. And in socially, actually it affects to impairment of interpersonal relationship, especially with the peer because they are adolescent. And then also it affects to maladjustment at school. So it's a kind of really big problem for the adolescent. So Scoliosis Research Society, it is one of the biggest society for the scoliosis. Actually, they are funded from the, Then actually the society start to examine how the health, quality of life how is the quality of life for the adolescent who is having the idiopathic scoliosis. So they made a measurement named as SRS. So recently they developed the SLS-22 revision patient questionnaire in 2006. So assessment of health-related quality of life have focused more on physicians and researchers because it allows assessment of a patient's perception of AIS condition and medical treatment effects. So the measurement has 5 domains like pain and mental health and satisfaction with management and image and appearance and function and activity. So better understanding of the health-related quality of life of idiopathic scoliosis adolescents is needed to identify patients' perception of their condition and treatment effects by severity of disease, which will contribute to improved care. So I had a second question, how is different the health-related quality of life by severity of idiopathic scoliosis? So I did the study for characterizing the disease severity in adolescents with idiopathic scoliosis in Korea. And the second one is characterizing health-related quality of life by disease severity in adolescents with idiopathic scoliosis in Korea. So I did the descriptive study design, and then totally 110 adolescents with idiopathic scoliosis were recruited. And then I did the study at the 2 hospitals. It's like a tertiary hospital in Korea, in Seoul. So I recruit the patients from the outpatient orthopedic clinic and a rehabilitation clinic. And the data were collected from November 2010 to August 2012. The period of the data collection is kind of long because we did not actually met a lot of the patients from the clinic, so we extend like the data collection is like that long period. So to recruit the study participants, research assistant explained the purpose and intention of this study and ask for agreement to participate from adolescents and their legal guardians. Inclusion criteria for the study participant was primary diagnosis of AIS determined by expert clinicians and cups angle over 10 degrees and age of 10 to 19 years old, and participants and their legal guardians agreed to participate. And then the exclusion criteria was any diagnosable musculoskeletal disease except the scoliosis and cognitive impairment causing inability to read and understand the questionnaires. So how we measure, get the information of the cups angle of the patients, actually we got the medical records with the permission of the patient and their guardian. And then we provide the measurement of for checking the health-related quality of life. So I used the SRS 22 revision. So I already explained it, but it has a 5 domain, and then each item allowed 5 response levels from worst to best. And higher mean score indicates higher quality of life. And Cronbal alpha of the measurement was 0.84 in this study. So to assess the differences in health-related quality of life according to the severity of AIS, data were analyzed using PASW window. So I did the descriptive statistics and cross-cohort test and man-within U test, and then ANOVA, because I did not have enough patients to do the parametric statistics, so I did the non-parametric statistics. So results, okay, as you can see this slide, actually among the 100 participants, 52 is like a 47.3% adolescents were categorized as having mild AIS from the 10 degree to 25, and 41.8% of the patients were having a moderate, and 10.9% patients had a severe AIS. So the mean age of the participant was 14.2 years old, and the mean age of AIS diagnosis was 12.5 years. The table 1 summarized the personal characteristics of the study participants. So among participants, female adolescents were the majority, like 80.9%. However, the 3 severity levels of idiopathic scoliosis group do not show significant differences by the gender. Most adolescents were diagnosed with idiopathic scoliosis during their late elementary school age. It's like a 48.2%, and junior high school age 44.5%. However, there were no significant differences among the severity groups by diagnosed age. And all participants were treated conservatively with observation and braces and physiotherapy, like a physical therapy. Observation of spinal curvature changes was performed in 61.8% of cases, with 78.8% of the mild group and 58.8% of the moderate group. Then the treatment with braces and the physiotherapy were mainly provided for the severe IS group. And differences in health-related quality of life with the SRS-22R, according to the general characteristics, are summarized in Table 2. The total mean score of SRS-22R was not significantly different by gender. However, adolescents diagnosed with AIS in late elementary school age showed a significantly higher SLS-22 score compared to the adolescents diagnosed with AIS in junior high school age. Also, it significantly differed with type of treatment. The lowest score occurred in the physiotherapy only group. And then the table 3 shows the health-related quality of life of the study participants using SRS scores. The total mean SLS-22R score was 4.21 out of 5. Among subdomains, the self-image and appearance domain had the lowest score among all participants. The median SLS-22R score of the mild group was 4.30, and that of the moderate group was 4.20, and severe, it was 4.07. And then the median score did not significantly differ by the severity. However, the mean score of the self-image and appearance subdomain was significantly differed with severity of the disease. The score of the severe group was lower than the scores of the mild and moderate groups. So I thought like the age of disease diagnosis is high during the late school age, like 10 to 12 years old, and then junior high school age was the following the highest group. However, in Korea, school screening regulations do not include scoliosis detection. So results suspicious for idiopathic scoliosis are occasionally reported to physicians from chest X-ray result of a pulmonary tuberculosis school screening examination. The meaning of this actually, our health government actually are doing taking the X-ray to check the chest tuberculosis. So during that examination, actually, we can diagnose the patients may be having some problems of the scoliosis. That's why it happens. And so many adolescents are initially diagnosed with that disease around 13 years old. So I can conclude did any of the early detect or has problem to regulation in our country. So in general, actually to compare to the USA, they are recommending taking the X-ray or having some screening at age 10, 12, 14, and 16 years. And then even the SRS, the Scoliosis Research Society, has recommended annual scoliosis screening of all children aged 10 to 14 years. So I suggest that an effective scoliosis screening program should be implemented in the Korea school screening regulation. And the specific time of scoliosis screening examination should be determined according to the age-specific characters of idiopathic scoliosis by gender difference, because female having a lot of the cases. Then the next one is the self-image and appearance domain score was significantly different with the different severity groups. So it is like 7.7 out of 5. It was the lowest score. So I thought we should be aware of how idiopathic scoliosis adolescents perceive their self-image and appearance by the severity of their spinal curvature. So it's really, good point. And then almost done. Overall mean score was 4.2 out of 5. So it did not differ with the severity of the disease in this study, but the sample size were relatively small and the number of the patients in each severity group was not even. That's why I think it seems like not significantly, but that's why I thought a larger and even sample sizes in each severity group could uncover a greater range of the health-related quality of life characteristics in our country, the adolescents who is having a idiopathic scoliosis. So Korean adolescents with idiopathic scoliosis tend to be diagnosed at an early pubertal period. Is like a late elementary school age. It's a little bit earlier than the another country. This indicates that the prevalent age for AIS is slightly earlier, and so we need for early screening examination. And total score was not influenced by the disease severity in my study, but self-image and appearance was significantly different with the differing the severity. So medical staff should be aware of the characteristics of Korean AIS and variation in the HR/QOL characters of adolescents with the disease based upon the severity. To enhance the health-related quality of life of idiopathic scoliosis adolescents, medical staff should consider developing strategic tailored to individuals based on disease severity. So this actually I'm ending up my presentation. So this is our country's viewing. So if you are really interested to come to our country, then welcome anytime. And muchas gracias. Okay, thank you very much.